This is a side-by-side comparison video of the Bard Foley catheter system and the Hallstat Foley catheter system. To briefly explain how these catheter systems work, there is a drainage tubing or a Foley catheter that goes inside of the patient's bladder. The urine drains through the catheter, through the drainage tubing, then usually into a meter device to measure the urine. And then after that, the urine is collected into a larger bag to be disposed of at the end of the day or at the end of the shift. This is the Bard Foley catheter system. Bard is currently the leading competitor in the market around the world and has about 80% of the US market. So this is by far the most used and high-end catheter system that is currently in the market. Starting with their Foley catheter, you'll notice that their catheter has a yellow color to it. That's because it's made out of latex. Latex has been shown to be less biocompatible with human tissue and is more friendly to bacterial growth. So it promotes more bacterial growth because of how porous it is inside. So this latex catheter is actually an inferior catheter, more harmful to human tissue, and promotes more bacterial growth. You can't see it, but this catheter is actually coated with a very thin antimicrobial coat that consists of small ions of silver. This silver eludes through time and kills bacteria as it passes through, but usually after 7 days, the antimicrobial coat is almost completely gone, and by 14 to 15 days, you'll have almost no coverage or antimicrobial coat on this catheter. This is their drainage tubing. The Bard drainage tubing has a bacteriostatic coat, so it's coated with a coating that reduces bacteria's ability to grow. It doesn't necessarily kill bacteria, but it reduces its ability to grow, and then it is dumped into this 350 ml urine meter, where it is measured in the hospital either hourly or every 2 hours, and then it is tipped back and dumped into this larger bag. This is the Hallstatt Foley catheter system. As you can see, the Foley catheter is clear. That's because it's made out of 100% silicone, which is a much higher end quality of polymer for Foley catheters. Silicone has been proven through multiple research articles to not be as good at growing bacteria as latex is. So it's harder for bacteria to adhere to silicone as compared to latex. It also has a much more smooth surface, so it causes less trauma to the bladder lining and also the urethra, and is a lot more biocompatible to human tissue. All Hallstatt Foley catheter systems are 100% silicone. We will never use latex, and in fact, we are trying to educate the hospitals and the medical professionals as to the harm that latex causes. This catheter as well is also coated with an antimicrobial coat, even though you cannot see it. It is different to Bard's coat. It does not use silver ions. Instead, uses a technology that repels bacteria, so it doesn't allow bacteria to adhere and multiply to the catheter. So even after 15, 20, and even up to 90 days of use, we have seen zero bacterial growth inside this catheter system because of the technology of our antimicrobial coat. You'll also notice a small ball towards the distal end of the catheter. That is our anti-reflux valve. It is a valve that prevents urine from flowing back into the catheter and into the patient's bladder. This has been a known issue for a long time, since at times urine drains into this drainage tubing, collects the bacteria that's growing inside of here, and can reintroduce that bacteria into the patient, immediately giving them a urinary tract infection. This is the only system that will be on the market that has an anti-reflux valve that works inside of the Foley catheter. Although this is latex and you can't see anything inside, this does not have any anti-reflux valve. Bard actually attempted to make something similar and they failed. As you continue down the drainage tubing, you'll notice a small a larger air filter here. This air filter is used to introduce small amounts of air into the catheter system so that the urine drains more easily, and also so that the bladder collapses softer onto the catheter. This is significant because bladder trauma has also been reported with these catheters. As the bladder slowly collapses onto the catheter could puncture or irritate the bladder and cause trauma and disrupt the bladder lining. This catheter is actually a standard silicone catheter, but the system that we'll be introducing to the market will have a smaller tip that reduces bladder trauma. And so combined with the air filter and the smaller innovative tip, we will significantly reduce or completely get rid of bladder trauma. Whereas Bard's standard latex catheter does not do that. It still has a long protruding tip that can cause irritation to the bladder lining and even protrude through it. Our drainage tubing also has a bacteriostatic coat, so similar to Bard's, but we believe that our technology and what we're infusing inside of our polymer is actually more effective at reducing bacterial growth than Bard's. At the same time, Bard's drainage tubing, they report that with time it eludes, so it loses its strength and its capability to reduce bacterial growth. Whereas in the Hallstat system, it is infused inside the plastic, so it never runs out. It always stays as effective throughout time. We also use a softer PVC in our tubing, so it recoils and goes back into form a lot easier. If you notice, our tubing is softer and can be moved around and manipulated a lot easier, whereas Bard's is more rigid. So if this is ever bent or kinked, that kink stays on the tubing and creates crevices also where bacteria can grow, whereas our tubing is softer and rebounds a lot better, so that we have a reduction in kinking inside the tubing. As the urine continues to drain through the tubing, it goes into the Hallstat urine meter, which is a 500 ml urine meter as opposed to a 350 ml urine meter. This is significant for nurses, especially in the ICU, where we're often measuring high outputs of urine through a small amount of time or a short period of time, and we often give medication that causes the patient to produce a large amount of urine. So in the Bard system, if they pee over 350 mLs in 1 hour, that pee will dump out into this larger bag and you will only be able to measure up to 350 mLs. In the Hallstat system, we can measure up to 500, which is a significantly larger amount of urine within 1 hour, so we get more accurate readings. We also have our urine meter separated from our larger drainage bag, so they don't communicate. They're not one piece like they are in the Bard system, so it's harder for bacteria from this bag to communicate into our urine meter, and vice versa. They act as two separate pieces. So once the urine is collected into this urine meter, you open the switch valve, and then the urine is drained into this larger bag, and then it is closed. In the Bard system, once the larger bag is full, or at the end of the day when you need to drain the bag, you have to open the bottom, release this port, and drain the urine into a dirty container. So it is a very unclean process where urine spills. It could get on the nurse, it gets on the floor, on the bed, and it does not promote a closed system. In the Hallstat drainage system, this bag can be disconnected at the end of the day and thrown away. And then a new sterile bag is introduced into the urine meter, and we have a new sterile bag every 12 hours, promoting a much cleaner system, a much cleaner way to dispose of the urine for the nurse, and a way in which it doesn't pour or spill urine anywhere into the hospital, which increases bacterial growth and general infection. Besides that, the Hallstat catheter system also has a better dating system, which is right in front of the urine meter. This is significant because indwelling time is very important when it comes to reducing infections. The FDA only allows these systems to be inserted inside of a patient for up to 28 days. Really, anything past 15 days will increase your chance of getting a UTI significantly. But especially if you go past 28 days, then it will greatly increase bacterial growth. So having a proper dating system significantly helps the nurses to remove the catheter at an appropriate time. Whereas a Bard system comes with a sticker which you place in the back and is not visible, and often creates inappropriate usage when it comes to removal of the catheter system.